Hi, this is Natural Health Radio, and with you today is Mark Alyn and Dr. Theresa Dale. I want to welcome you to the show today. We have a lineup of educational information to help you with your choices, with your decision-making process related to your health. Very important that when you're making a decision related to your health, that you have all of the information that you need in order to make the correct decision. Because we know what happens if you don't.
What happens?
Well, you make a mistake. You can make a mistake, and a mistake could be life-threatening mistake.
Right.
So we are your source for educational information that will round out the holistic, the natural, and give you serious options to look at.
We're going to talk about pregnancy today, I understand.
Right. We are going to talk about pregnancy and about specifically women who are wanting to get pregnant and not able to, and the various things that they do medically in order to attain that goal.
And to have kids, to have kids. I have to tell you an interesting thing. The other day I was listening, as you both know, Daryl Wayne is here too, to an old-time radio show. And I didn't know today's topic, but it just popped into my mind. It was a Sherlock Holmes adventure. And this nobleman kept killing his wives because they didn't bear him any heirs. Okay? And of course Sherlock Holmes solved the case and said, Sir Manfred, whatever his name was.
You need therapy, right?
Yeah, oh boy, does he need therapy. I think at the time they hanged him. I'm not sure, but I think that's probably what they did. My point is that throughout history, it's always been thought that the woman was the cause. She didn't bear the kid. However, I don't know what the percentage is, and maybe you can help me. Low sperm count, the little buggers don't swim fast enough. There's all kinds of different things that men can have that can affect having children as well.
Mm-hmm. Yeah, they just need to swim faster and eat their Wheaties, or a gluten-free Wheaties. So I mean, here's the thing: it's men, it's women, it's consciousness, it's their belief systems. If you have your mate, your husband, your mate is saying that they want to have children, but really they don't want to have their children, they don't want to have children, this can affect it. This can make you not pregnant. So I think it's the intimacy between two people and the communication about, looking to make sure that both people really want to have children. Now saying that, a lot of people who don't want to have children every day because, they're not planned, and you know what I'm saying? And so, but oftentimes when you're trying too hard to have a child, you can push that whole energy away.
But at the same time, I understand practice makes perfect, or makes pregnancy.
Yeah, it can make pregnancy.
And fun.
So, low testosterone, low T is an issue, and a man can get that checked out with saliva testing, which is more accurate than blood testing. You might see a total polar opposite result with saliva test, or you'll see a low T that's much lower. You're going to get the truth with the saliva test, whereas with a blood test, it's all up in the air. And so you're treating something that may not even be the right thing.
We're talking about getting pregnant, and we're going to talk about a natural way of doing it, as well as, I guess, an emotional and spiritual way. One of the things that not confuses me, I guess it's embarrassing, okay? I have two great kids, and we did it the natural way, okay? The real way. We just kept practicing, and bang, bang. We didn't even have to practice all that much, come to think of it. However, one of the to me as a man, one of the downsides of in vitro fertilization is you go to the doctor, you go to the clinic, they hand you a dirty magazine, what we used to call a blue or dirty magazine, and I do have mail? Oh, good. And one of the things that they hand you the magazine, they hand you a cup, and you have to go in and,
give a specimen.
Give a sperm specimen.
Uh-huh.
I find that really embarrassing.
Yeah.
And that could affect the outcome.
It can affect the outcome because it can affect the outcome as you give the specimen. You know what I'm saying? Because the process of doing that and the concern and what if it's my fault and all of those things can affect the output. Just like if you're giving when you're taking blood. You're sitting in the office, you're afraid, they're sitting you down, they're taking your blood. Now, if it's too high, we're going to do this. And, you've got all of this stress. That'll make it higher.
But at the same time, I mean, you have blood samples taken for your patients at times, right?
Yes, and for myself.
And
absolutely.
Right.
Absolutely.
But just sitting there with a phlebologist, don't try this at home, folks, is always stressful to me.
Yeah.
Even if they're gentle.
Yeah. Well, here's the thing. Getting back to that sperm specimen.
Right.
Okay. So you give the sperm specimen and, and then if you have low sperm count, you kind of feel like it's your fault. And the solution is a testosterone patch or a testosterone gel or something. And that is really not the solution. The solution is getting a saliva test, finding out the truth, and using a program to detoxify the body so the sperms want to swim. They're going to want to, they have to have energy. Your body has to be energetic and healthy and happy.
And traditional allopathic medicine, my understanding is that they'll take a sperm sample, they put it in a centrifuge, and they make more sperms per square inch and inject it.
Right.
Right.
So this is a way that is, you don't even have to do it that way. Okay.
So you go back to the natural way of making babies.
You go back to the natural way and you do a saliva test, you find out what's out of balance, if anything, and then the male will use a homeopathic testosterone, which will increase testosterone. We've seen in blood testing before and after, 48 to 72 hours using homeopathic medicine.
You have one on your website.
We do. And then also with women, so many women come to us after in vitro and say, I can't do this anymore, it's not working. Meantime, their body is totally toxic from all the hormones. So we need to do a saliva test to determine the current hormone levels after doing this all to your body. And they're always really out of balance. I don't see how a baby would want to come into that.
Well, one of the things that I understand with in vitro, first of all, it can be embarrassing, it can be painful for the woman, and it's expensive. It's frightfully expensive.
Right. Well, it's just
I mean, we're talking thousands and thousands of dollars.
Traditional medicine, that's part of the process. And
so
to eliminate that part, Mark, all you have to do is to learn, be educated, be a little bit more educated.
Be open.
Totally be open and educated to doing it a way that will work.
Let's take a look. If my wife and I were thinking about having another baby, there would be...
I'd send you to counseling.
Yeah, please. I wish I had said that. If we were, in the looking to increase our family, and came to you, you
wanted to adopt me?
I was hoping you would adopt me. Maybe Daryl will adopt both of us. But if we were to, and I want to talk about adoption as an alternative too, but if we were to come to you, instead of going through in vitro, which can be $20,000 or more for a treatment round, what's the cost from a homeopathic standpoint?
Oh gosh, it's extremely inexpensive. Well, and by the way, not only do I do this, but I train doctors to do this. So we have 7,000 doctors who do this.
Gotcha.
Okay, and have great success. So what we need to do is to first do a saliva test. You're talking about less than $400, and then you're talking about a program to take to heal the body, to fix the issue, including homeopathic testosterone and detoxification and all of the things that are necessary according to the test results. And then you do that, and that may be over a 3-month period, about $1,500 at the most, depending upon...
Versus 20,000 or
right,
more.
Versus, you may need less than that. I'm just giving you the
Sure.
outside of what it possibly could cost for 3 months.
And a lot of that is testing and
Well,
and
you
products.
just need one test in the beginning and one test at the end of the 3 months.
And of course, a lot of practice recommended in between.
Right.
We're talking with Dr. Theresa Dale here on Natural Health Radio. I'm Mark Alyn. We're talking about getting pregnant. And we've talked about problems from the male standpoint. Is it basically the same for women?
Women's issues are different. They feel anxious, a lot of anxiety, and the hormones that they're taking don't do that emotion any good. In other words, it exacerbates it.
I was going to say
so they have
that.
extreme anxiety. And I can see that little soul looking from above going, I'm not ready to go into that anxiety mess right now. You see? So I can see that, and when I test a patient to determine the optimal program for them, and they're not only worried about having a child, they want to have a boy or they want to have a girl, and it's like you just have to let go and allow the body to do what it will do naturally. And I always remind them, and they're saying, oh, it's so hard to get pregnant. I said, do you know the bush people in Africa, the people who live off the earth, they have no good, their nutrition is awful. But they're happy people, okay, and they get pregnant all the time.
At 15.
At 15, well, even later at 40. The point, is that the only problem is what's in their head, what they are made to believe, or they're given to believe, and then they choose to believe it.
What do you think of a lot of actors and actresses having babies later in life? I'm going to say in their early to mid 40s. That's one. And the fact that they're... I don't know if I have issues with it or not in terms of, let's see, by the time that kid is 42, the father or mother is going to be 84, right?
Well, that's interesting because it could be that's, as people get older, they get wiser. It could be that is a good choice for that person. So I know that my mother was 43 when she had me, and it was very healthy.
43?
Mm-hmm.
Oh, my.
Yeah. And, so the whole thing is that I think it's okay if you're healthy, and if both people are healthy, they know what they're doing, they have pretty good genetics, and they look at all of these different things and detoxify, and I don't see any problem with it.
We are talking here on Natural Health Radio about pregnancy, about getting pregnant, and I want to invite you to go to the wellnesscenter.net website, wellnesscenter.net website. There are a number we're talking about cleanses, we're talking about detoxifying. There are a number of articles and stories about detoxification, as well as the actual products that Dr. Theresa Dale has developed just for this use, to cleanse the body, to rejuvenate the body. And you can learn about wellness resources also at wellnesscenter.net. This is Wellness Center for Research and Education. Dr. Theresa Dale, she's a PhD in CCN, certified clinical nutritionist. She's an author, a biological medical consultant, and a friend to all. And you can find out more by going to wellnesscenter.net. Wellnesscenter.net.
So, the whole thing, Mark, is that women who want to get pregnant, let's say they've never been pregnant, then it's even a bigger issue for them, because they want children desperately. And the issue is that they can get pregnant. Sometimes everything is right. The sperm count is all right. Everything is all right with the woman, and they're still not getting pregnant. It's mental. It's emotional. And they need to do some work in that regard.
Can it also be, in these people, you used the word desperate. People are desperate to have children.
Yes.
There's so many kids that need to be adopted.
Right.
That my heart reaches out to those kids
Mm-hmm.
who want a good home.
Yes,
And
I agree. I mean, I think that for those people who are desperate to have children, that maybe the message that they're getting is adopt. Maybe that's the message. Maybe the message is not that the problem is they're not having children. Maybe the problem is, or the solution is, that they need to adopt, and they need to open their heart and start meeting children. And meeting one, you would want to adopt it, right? I mean, It's
Right.
like, so,
what happens, and I don't know the statistics on this, but I've heard numerous stories. People try to have babies, they can't, they adopt, and as soon as they adopt and that new baby comes into their home, they get pregnant.
Right.
Because they're still practicing.
Right. And I think that's great. Then they have two. And it's awesome. I think there's always room for more love, for more people. I think adopting is great. And I think from United States or from other countries, whatever you feel like whatever you want to do, I think adoption is the best way.
Rather than going through all the testing with homeopathic
it's not rather, it could be in addition to. It could be, it doesn't seem like we're successful at having a child, let's adopt. And then when you let go of that whole idea, you get pregnant.
I don't know why it happens.
You
It's
let
magic.
go of it. You let go of it.
It's receiving.
You don't have that intensity, that desperation anymore, because you can push things away when you start desiring them in a desperate way. And so when you let that go, the soul comes in.
In my own personal life, I didn't want kids. I don't know why. I didn't until my father passed away. And there was a father light switch that went on in my head that I wanted to have kids. Mm-hmm. Is that interesting, funny, or common?
No, it's, I don't know if it's common. I think that we're all so unique, and what makes us up is just miracles. I think that was a miracle that switch went off.
Well, to me, that was the silver lining when my dad passed. If you will.
Right. So you wanted to then have children. I think that's wonderful.
Yeah.
Yeah.
And I did. I have two wonderful kids, and I'm very proud of both of them.
Wonderful. Well, I help a lot of people have children, and I love doing that, and I love working with children. They're just, I see them all as being healthy. I see people, when they come in with an issue, the most important thing is that you don't see the issue, you see the person. And when you see the person, you see the miracle, the joy, the health, and the wellness that is there innately. within their innate intelligence, they have that. And if someone doesn't support that and make it grow, then they support the illness. Do you know what I mean?
Sure.
So, yeah, so I feel that when people go to a health provider, find someone who supports the wellness and knows that the innate intelligence that you have in you is making you well right now. You just can't, you can't keep seeing the problem because the problem isn't real.
Right. I also think that children obviously are our future. We had Sheila Unique from Canada on, and she's a medical intuitive and does a number of other things. But her current journey is to train teachers to work with kids in helping them understand and communicate better. And Sheila's a great lady. I spent some time with her in Las Vegas when I was speaking a couple of weeks ago. And she's just, dynamic and full of energy.
Great. So I'm glad that you had her on and exposed her to all of your audience. That's great. So what we need to do is to look for people like that who can give you and help you with your own awareness and who has healthy instincts. So if the instinct of the health provider is to go for the surgery or the drug or something like that, that is an instinct that doesn't empower the person.
Let's talk about kids if we can. So the baby comes, and brand new mom and dad, they call you at 3 a.m. Are they allowed to do that, by the way?
They never have to do that.
Okay.
I really help people so they really don't have issues.
All right. So
but if someone did, I would be fine with that.
My question is that, what happens today is new parent, I went through this, the baby is fussing. We don't know as new parent if you should change the diaper or feed the baby.
I know, it's right.
So you do one and you do the other, and it's not in the right order, and the baby fusses, okay? So you call the doctor. My baby is sick. This is just, I think, human nature, but...
I think so, too. And I think you need to have some tools in your arsenal. A good thing to do would be to sing to the baby to see if that calms the baby down, to put on some music for the baby, because frequencies are so healing, and to have tools available to see if you can get the baby to calm down a little bit, change the diaper, maybe it's feeding, maybe it's not feeding.
Sure.
And I don't know if the answer is to call the doctor, but I know that an answer is to have an arsenal of homeopathic medicine at your disposal for different...
newborns?
Absolutely. For newborns.
I can see it for,
For newborns. Now,
for newborns,
yeah,
too.
They come in little pellets. And those little pellets can be crushed up into a powder, and you just need to put it on the tip of the tongue. That's it, once. Just a little touch for calming down, chamomile for calming down. You can have, if the child has intestinal issues or gas, you can give a little bit for that. And because it's homeopathy, it does no harm at all for anybody. So it's good to have an arsenal of those little tubes of homeopathic remedies that you can give the baby, the infant. Absolutely.
Do you see or have you seen babies?
Yes, many. But I don't do that now because I'm not really practicing as much, and I'm mostly training doctors in how to work with babies.
Gotcha.
But I see babies as being, it's great to work with children. I've seen them all ages, and sometimes when they come in, they say the most amazing things. Mark, they say, 5, 6 years old, come in, mom and dad are really worried because the child has a tummy ache and is pointing, tummy ache, and the child comes in with me, And the mom's sitting in the room, and I say to the child, "How are you feeling?" And he goes, like shakes his head, "Okay." And I go, are you sick? And he goes, no. And I go, what is it? Well, my mother thinks I'm sick. I've heard that, I don't know, or my father thinks I'm sick. The worry from the parents will affect the child's health. That's interesting.
And of course, a lot of times the kid just wants to stay out of school and says, "Dad, Mom, I have a tummy ache,"
right?
And wants to do that too. If you were thinking of a career in the holistic and homeopathic health field, there is a great place for you. It is called the California College of Natural Medicine. The California College of Natural Medicine. You can find out more information by going to cconm.com. That's hard. I'm going to slow it down a bit. cconm.com. Lots of information on courses, classes that you can take that will help you understand health better for you and your family, or you can actually have a career as in this here in the state of California.
Absolutely. And in other states as well, where the laws are reciprocal.
The mission is to offer advanced certification and continuing education trainings and to evolve the field of natural medicine, including nutrition, various forms of energy medicine such as homeopathy, herbology. It's the only educational facility in the world that offers neurophysical reprogramming, a medically proven hands-on method of resonance. Wow, assessment and healing. What is that?
Well, you're testing the individual. You're using a protocol to test the individual to find out genetic predispositions, to find out all kinds of issues, emotional issues, and physical issues that are causing the problem. In other words, a person, an adult with a health issue diagnosed, it could be caused from a predisposition of some kind. Now, that predisposition doesn't need to manifest, but lifestyle and what have you are creating it to manifest. So we find out what we need to do to turn that around, shut that thing off so that the condition can completely be eliminated. And I remember when my father, it was very interesting as I think about one of the first people, when I invented this, I tried it on my dad, who's from Switzerland. He was not well at home with a few different issues. One of them was his marriage. But I mean, looking at that in a light way. He had Parkinson's disease, and I worked on him, and we found what was causing it, which was not only it was a little bit of a predisposition, but more it was his marriage, is the variety of different
Is that to your mother?
Yes.
Okay.
Yes. And so that caused it. And so we eliminated that. And we eliminated the energy pattern that was causing that.
I thought you eliminated your mom.
No, we eliminated the energy pattern that was causing that. And so he didn't shake at all. It took about 3 weeks for it to completely balance out. And then, it was like a few years later, 5 years later, when he passed away from a stroke. They lived in New Jersey, and I didn't, so I couldn't work on them all the time, but I did as much as humanly possible. So the thing is that you can make changes even with your family with neurophysical reprogramming, and if it works with your family, it's really good.
And if if you want to learn that,
you can learn that at the California College of Natural Medicine.
You said something that's interesting. You said a lot of things that are interesting, and working with energy like that has got to be unique in terms of in terms of modern, so-called modern day science?
Well, it's unique, and it's completely different from modern day science, but I created it after studying in Germany for 9 years and studying with physicists and biophysicists, and I started putting things together, you see. And then the thing they didn't work on was emotions. They, used homeopathy. They figured the homeopathic medicine would take care of the emotions, which was partially correct, but not the tough stuff. The tough stuff, you need to do something different and actually change it on things on a cellular level, in order to change the way that your body's aging, in order to change issues that are coming up that you've never had before. There's a reason, So I love doing that. This is totally unstressful. It takes me an hour and a half. It's first per session. I train people to do it, and I train a lot of health providers to do it. So they're with a patient for an hour and a half, and when you're done with the person, they don't even remember when they came in as far as what they had. They don't even remember what you worked on.
I've had energy healing a couple of times, not with you, actually with Barbara Savin, who works at the California, I'm trying to think, it's at the Four Seasons Hotel in Westlake Village, the California Wellness Center, I think, something like that.
Was it Reiki or something?
Yeah, it was Reiki. She didn't touch me at all.
Right.
And until the end. I mean, I had several sessions with her, and we should have Barbara back on the show. We should maybe bring her here on Natural Health Radio. What would happen is I just pass out. I mean, I just go into a very deep sleep, and then she'd say, Mark, wake up, and kind of touch my shoulder and shake me a little bit and say, Mark, we're over time.
Done.
I got another client coming in. You got to get the hell out of here. Or she didn't say it like that, and I'm being facetious, but
right.
I found it extraordinarily relaxing.
Well, this is completely different. This is a medical procedure that you do with someone where you're finding the belief system and identity that is causing the issue. Who is causing the disease? Who is causing the issue in your body? You're tracking it in the 5-element theory of Chinese medicine to find out in what organ it is. Where is it in the organ? What is it manifesting in the organ? How deep is it? And then you're doing a process that's active with them so that the energy pattern can be completely neutralized. And then when it's neutralized, you put in a new champion identity that will champion what you want to experience.
Is that a process that the patient or client works with
I
as well?
take them through this. I do it with them so that they are empowered and are part of the process. And it's really fascinating for everyone involved. And it's my favorite thing to do in working with people. I do it as much as I can with people, but I don't have as much time as I would like to do that. So I teach it. When I teach it, and in class with the doctors,
so you can reach more people
on.
with that.
Right.
That makes a lot of sense.
So this has been tested with independent neurologists before and after, working with children who have been raped and having the memory of that, of being gang raped, and testing them before.
Oh my God.
And then doing the process and seeing if it brain maps before and does it brain map after. And in every case, it doesn't brain map after. In other words, once they have the session in the after testing, and we're brain mapping it, and with the EEG, 32 electrode EEG, EKG, there's nothing that shows up, and they have no charge on it whatsoever. So it really changes.
Do they remember?
They remember, but they just don't have a charge on it. Like it doesn't.
It's not taking the power.
Yeah, it's not. They're not upset. They're not anything afterwards. So we've worked on a lot of people in that kind of a setting so that I could prove that it works. And so I've done that, and that's why I teach it.
I'm Mark Alyn, along with Dr. Theresa Dale, who is wearing a polka dot dress today. And I have a question. Do you know what famous actress with red hair wore a lot of polka dots? You know.
Lucille Ball?
That's it. I love Lucy. Yeah, one of my favorites, right?
Yeah, right. And
So
red hair.
Red hair, very
Right.
attractive.
She was very, just very funny, very, just I think naturally very funny. Just as a
No,
part of her.
absolutely.
It wasn't anything that was contrived. It was like part of her being. And there are some people that are like that in life,
I've been called funny, but I don't think it's the same. I loved her except when she did Mame. She did the film Mame.
Yeah.
And she couldn't sing anymore, but oh well. She was the boss of Paramount, so she owned it. So she could do what she wanted,
yeah,
right?
Right.
As we have about...
We're moving along here
we
on
are.
time, and we need to talk a little bit about the Wellness Center.
Yes, I was about to talk about the Wellness Center for Research and Education. If you want information, visit wellnesscenter.net, wellnesscenter.net. This is a website that Dr. Theresa Dale has put together. It has all kinds of information that you need for your life, for you and your family and your friends. There's free information, there's free testing, there's free videos, there are free audio programs, and of course lots and lots of written material for you to read about natural health that can make a difference in your life. I encourage you to visit wellnesscenter.net, wellnesscenter.net. Support healthy vision. There are body cleanses. There are organic cleanses. There are all kinds of different things that you can learn and use at wellnesscenter.net from Dr. Theresa Dale.
Well, thank you so much. And I think, Mark, you have learned so much working with so many people, interviewing so many people about healthcare. And, sometimes you need to ask the tough questions, too. Like, how can you prove that what you're saying really works?
Well, I've asked you that.
And, I know, but I mean,
right?
asking, it's very important. It's like, how can the whole thing is like, for me, it's like I wanted to do the saliva testing and test my products or my whole program with the saliva testing before I offered it, before I really went into it. And I was really amazed. I was shocked at how well the homeopathic hormone rejuvenation works. I totally didn't know how it would be if I put it into a very clean base that is applied topically. Because it's never been done before, and I thought, oh my God, what if it doesn't work? And then I thought, well, we'll just test it and see, And women, it works right away when people put it on, and I have the oral one for men. It's like the homeopathic hormone rejuvenation for testosterone.
And then what's that called? So people
it's called the Endo Pure Testos. It's got a little tiny golfer, on the label.
A golfer?
A golfer.
A golfer. I thought you said gopher.
No, I thought about having a
muscle man?
A muscle man, and I thought, no, most men are going to, like maybe they're going to react to that. Let's put a golfer. Golfer's a very intelligent sport, golfing. Yes. So anyway, I think...
Do you golf?
I wish I had an opportunity. I've hit.
Like at a driving range?
Yeah, I've hit. I love it. It was great. I would love to do for someone to put up with me and take me out to golf, because I'd be a beginning person.
Have you golfed?
I enjoy the meat and game, which means I don't play it too well.
Yeah.
I've been out a lot, yeah.
Did you really?
Yeah.
Wow.
I love golfing. I love
I like
sports.
miniature golfing.
I do that very well. I
Do you?
can go through that course in no time. Bing, 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 bing.
Got it. And you like hiking.
I am into exercise as much as possible because that keeps our cells rejuvenated, and sweating is very important. People don't like to sweat. You know, sweating at the wrong time is not good, but sweating when you're supposed to. When you exercise, if you don't sweat, then your lymph system is clogged up. It's toxic. You have to detoxify your body because a little bit of exercise should cause sweat, even a little bit.
It's summertime when we're recording this now, and it's very warm here in Southern California.
Right.
Above average heat. Last week was unbearable.
It was so hot last week.
It was, and this week it's a little less hot, but it's muggy. We have a lot of humidity in the air. How do we combat that? I mean, just walking outside to your car, we're going to sweat, the three of us.
Well, it's not here where we're pretty close to
the
not
beach.
too far from the beach. So, it's like a little, you can find the breeze out there. But if it depends. You just do everything you can to sweat, and then make sure if you're exercising and you sweat a lot that you have some sodium, some salt. Because you can throw your electrolytes off and not feel good and actually have low energy if you don't have enough salt or sodium in the body to balance. Your electrolytes need to be balanced.
That, I think, was the genesis of Gatorade, which has got a lot of junk in it, too.
Oh, that's awful stuff, isn't
Right.
it? I hate to say that.
I don't
I'm
like
not sued for saying that. But
Yeah, I don't like the taste. I haven't. It tastes salty to me.
Right. Well, there is electrolyte water you can get at the health food store, or you just take a little bit of water, you put some aloe vera in it, you put a little bit of salt in it, and you drink that. So maybe some vitamin C.
Salt?
Yeah. Oh, like Celtic sea salt, and then you can put some ionic minerals that in there, and you're set to go and have plenty of energy.
I have some.
Do you like hiking?
I do. I don't do it as much as I should. Yeah, I do like hiking. I like being outdoors. I don't like bugs.
I don't like bugs either. Bugs are buggy.
Yeah, they are. Do you scream like a little girl? Because I do.
Yeah, well, that's your problem. I don't scream. I take action. I find in my house. I try
You
to
smack them?
No, I hate to smack them. I get my vacuum cleaner turned on.
And put them in there? Got
Yeah,
it.
I can't do that. But luckily here we don't have bugs. If we were living in the tropics or in Texas, we'd have major bugs in our house.
It's true. It's true.
You know, I lived in Texas. It was and also Sedona. Major bugs.
Major bugs?
Major
Oh,
bugs.
That would, all right.
That's
Two
why-
places I'm not going to consider. Last week, I was very proud of myself. I saw something green moving on my sink. And I couldn't, for the life of me, think what it was. And it was a little baby praying mantis.
Oh, how cute.
And it was. So I wouldn't touch it, of course, but I grabbed a paper towel, wrapped it in it, and took it outside and put it out on the grass.
Good.
Yeah.
Good.
Because they're good for your,
They're
they
very
eat
good.
the bad stuff.
They do. They do.
And if it was a girl praying mantis, they also eat their husbands.
Okay, well, that's good for them. It's like, so, you know, as we look at our healthcare, we look at bugs. We have natural insecticide, you know, for if you go out hiking and you don't like bugs, or the mosquitoes love you, there's two things to do. One is take a very high bee complex so the bugs don't like the way you smell and they won't come near you. But if you want to wear something on your body, just go to the health food store and get a totally non-toxic bug spray to keep them off of you.
What about citronella?
Citronella.
Citronella.
Citronella. I think it's CEN, Citronella.
And they have candles for that too.
Right. And they have it in essential oil, and that also you can put on your dog, you know, or a cat, to protect them from fleas and things and mosquitoes. And
And why do some people attract bugs and others don't? Just
you mean
sense?
attract them? Well, it's
if I'm around, I become the mosquito.
B vitamins.
But
you don't
I
have enough
become the
B
bait.
vitamins. Right.
I become the bait for everybody around.
Get a natural food-based 50 milligrams of all the B vitamins in one pill, and if you know you're going out, take 2 a day. And if you're just not going out, just on a daily basis, take 1 a day. I'll bring you some Optimal Multi Pro.
Oh, okay.
Yeah.
And that has a lot of.
Oh yeah, they're not interested.
Because I take I'm trying to think. It's a sublingual B12.
But that's only B12. That won't do it. You have to have all the Bs, the B6, all of the Bs.
All the bees. Mm-hmm. To keep the bees away.
To keep all of the bugs away from you, because they won't like the odor that is put off. Now, people can't smell that, or you sometimes can smell it in your urine, but you can't smell it on you. But bugs don't, mosquitoes won't come near you. We
live in an area, as you do, that have a lot of rabbits, and so our rabbits have been eating our grass. And
do they get high?
I don't no. High rabbits. Interesting. Very funny. But they have. I don't want to catch the rabbits because I wouldn't know what to do with it once.
They
I
could
caught
bite
it.
too. They do bite
They
once in a
bite
while.
and scratch, and they've got there's a disease with some rabbits too.
Right, rabbit.
And so you use rabbit repellent, and it's like wolf urine, or bear urine, and it is god awful stinky.
Yeah. So, rabbits are sweet. You can just, they
look beautiful.
They're gorgeous. So we only have a few minutes left. On our next show, we're going to be discussing autism and all of the natural things you can do, and also discuss vaccines, if vaccines are really something that we need to be aware of related to neurological issues. And we're also going to be having a very special secret guest.
Oh, boy.
Oh, yeah. So, and Mark and I will be here for you. So I think, Mark, did you want to leave everyone with something?
Yes, I did. I wanted to say, once again, visit the Wellness Center for Research and Education at wellnesscenter.net. Wellnesscenter.net. Heal your mind and your body. They have rejuvenation kits. There are balances for your body and your mind. You can go to wellnesscenter.net, subscribe, get the latest newsletter, the latest news and information, and even take some free testing. Learn more about Dr. Theresa Dale, all at wellnesscenter.net. Wellnesscenter.net.
Thank you so very much, and don't forget to listen to Mark at latenighthealth.com. Don't forget to listen to Mark. He's available as well. And we are here for you. Tune in every week, and we'll give you the latest that we can find that will help you have a healthier life. And don't forget, focus on wellness. It's what you focus on is what you're going to manifest. So if you focus on positive things, you're going to manifest positive things.
And eat well.
Yes.
Eat clean, eat well. There's a zucchini that I gave to Daryl that he could club somebody to death with. It grew that big.
Oh wow! That's wonderful.
I didn't grow it, but we got it. We were gifted a bunch of organic vegetables, and that was one of them. And
that's a wonderful gift, People, if you have a holiday or Christmas or something coming up, think about sending organic vegetables or fruit.
That's a very good idea. We had one problem, and that was we had a purple pepper, and it had no flavor, and a couple of yellow ones were no flavor, and then a couple had good ones. Oh, no, good flavor, good taste.
The purple vegetable is related to magnesium, the mineral that's in there that makes it purple. So very interesting. I want to thank you so much again. We will see you next week. Natural Health Radio. Thank you for being with Mark and I. Have a wonderful, wonderful week.
Bye-bye.
Bye.